Thank you for joining us again in our total joint replacement education. In the first video, we covered what to expect prior to surgery. In this video, we're going to cover what to expect the day of surgery.
In this section, we will cover what will happen on the day of surgery, including anesthesia, the OR, the recovery room, and what to expect throughout your hospital stay. Before reporting to the hospital for surgery, and unless told otherwise, do not eat or drink anything after midnight before your surgery, including coffee, water, candy, gum, or mints. When you arrive at the hospital for check-in, you will report to the admitting desk at the time discussed during your pre-op call. During registration, you will be asked to sign a consent for treatment and fill out any other outstanding paperwork. Make sure to have a valid identification, your insurance or Medicare card, co-payment, and emergency contact phone numbers. After registration, you will be directed to the surgical holding area, where one of our nurses will get you ready for surgery. During this time, an IV will be placed and you will be given IV fluids in preparation for surgery. You will remain in the area for 1 to 2 hours before your surgery. Unless instructed otherwise, we encourage one family member or close friend to accompany you during this process. We prefer that you remove and trust your companion with dentures, hearing aids, contact lenses, glasses, or any jewelry. Your nurse will place other possessions in a locker room while you are away in surgery. If necessary, security can be asked to safeguard any valuables if you do not have anyone here with you the day of your surgery. You will have an opportunity to talk to your surgeon before the procedure gets started. Your surgeon will answer any last-minute questions, confirm the procedure you are having, and location of operation. Your anesthesiologist will also meet with you before surgery to explain the type of anesthesia you will be receiving and any potential side effects that may occur.
The most common total joint surgeries that we do here at Lovelace are the total knee arthroplasty, total hip arthroplasty, and total shoulder arthroplasty. Let's talk about the anesthetic options for total knee arthroplasty and total hip arthroplasty. There are two choices of anesthetics for either of these procedures. One is the spinal anesthetic, the other is a general anesthetic. Let's start by talking about spinal anesthesia. Upon arrival into the operating room, you will be placed on the operating table where our routine monitors will be applied. Then we will ask you to sit up into the sitting position, exposing your back so we can place the spinal. Your back will be prepped with an antiseptic solution. The skin and deeper tissues will be numbed up with local anesthetic. A fine needle will then be placed into the spinal canal and injection of a local anesthetic will be performed. After which you will be placed in what we call the supine position, laying on your back, and you'll start to notice your legs and bottom getting tingly and warm. Eventually, you will get numb up to the level of approximately the lower rib cage. After placement of the spinal anesthetic, we will start to infuse through the IV a medication which will allow you to take a nap, allowing you to basically sleep through the operation, although the true anesthetic will come from the injection into the back. After completion of the procedure, you will be taken from the operating room to the recovery room. At this point is where it becomes rather strange sensation. Your brain shortly will start to clear from the sedation medication, but your bottom and legs will still be asleep. It is a very strange sensation, but please do not worry, they will recover. It's a total time of roughly 2 to 2.5 hours from the time of placement of the spinal to the time that sensation wears off. The other option to these surgeries is what we call a general anesthetic. At this point, you would be taken from the pre-op holding area to the operating room, placed on the operating table. After routine monitors are placed, medication will be administered through the intravenous. Within about 10 seconds, patients will be rendered unconscious, after which a small breathing device will be placed in the mouth down into the windpipe to assist breathing during the operation. At the end of the operation, you will be woken up, breathing tube will be out, and you will be taken to the recovery room where we will watch you and observe you for roughly an hour, monitoring your vital signs throughout. After the discussion of which anesthetic we will perform, discussion between the surgeon, you the patient, and the anesthesia provider of the day will decide whether it is appropriate to administer a nerve block, which will be a deposition of long-acting local anesthetic to cut down on the amount of discomfort that you experience after surgery. With the total shoulder arthroplasty, our choice of anesthetic is really limited to one, and that would be the general anesthetic. The block for postoperative pain relief would also be up for discussion, and that would be administered prior to entering the operating room. I hope this gives you a quick overview of what to expect from anesthesia on the day of your total joint surgery. Remember that the total knee or total hip arthroplasties can be done on either general anesthetic or spinal anesthetic. Our surgeons prefer spinal anesthetic, but when it comes to the bottom line, the choice is yours as the patient. Shoulder surgery, unfortunately, only has one option, and that will be a general anesthetic. Congratulations and best of luck on your surgery. If you have any questions or concerns, please do not hesitate to ask the anesthesia provider.
After surgery, you will be transferred to PACU, known as the Post-Anesthesia Care Unit or Recovery Room. One of our nurses will monitor you closely as you wake up from anesthesia. The goal during this stage is to control your pain and prepare you for early mobilization, which is when someone assists you with getting up and moving. Some people might need supplemental oxygen after surgery until their lungs start working at 100%. This is completely normal, and you will be educated on deep breathing exercises to improve your breathing. A Foley catheter will be placed during surgery and sometimes has to stay in place for the first night. Our goal is to remove this as soon as possible in order to prevent urinary tract infections. All patients will need to use SCDs or sequential compression devices. These are like sleeves with pumps that are placed on your legs. They promote circulation in order to prevent blood clots. If you are staying overnight, you should wear these anytime you are in bed. If you are sitting up in a chair, then you can do leg exercises on your own. These exercises will be provided to you.
This concludes our second video. In our final video, we'll review the remainder of your hospital stay and what to expect as you prepare for your journey home.